As restrictions are lifted and more things continue to open up, I've had people ask me if I think the pandemic is over. My response is that the pandemic is not over. Many places in the world continue to struggle with COVID. You've seen stories on the news about India and now in the United Kingdom. In our area, we still have patients in our hospitals. We still have individuals in our communities who have not been vaccinated, whether that be young children who are not yet eligible for vaccine or individuals who have chosen not to be vaccinated. I want to ask every person in our community, if you've not gotten the vaccine and you're eligible, please do. The higher we can get that vaccination rate up, the better off our communities will be going forward. The more protected we will all be from COVID-19 variants. We know North Carolina is working to encourage more individuals to get vaccinated, as well through the recently announced $1 million drawings for those who've gotten vaccine. While we've seen the reports from other states that these drawings have increased vaccination rates, we have not seen an increase just yet in requests for vaccination appointments within Novant Health. It'll be interesting to see how that plays out and see if this incentive encouraged people to get vaccinated. Last week, I think we spoke about the Delta variant, also known as B.1.617.2. And you may have seen that now this variant is expected to become the dominant strain of COVID-19 in the coming weeks in the United States. In the United Kingdom, it makes up 91% of new cases, and it was first detected in India, and it's had devastating effects there. About 10% of COVID-19 cases in the United States can be attributed to this variant right now, and that number is doubling every 2 weeks. So far, our current vaccines seem to be holding up well against the Delta variant if you get both doses. Those who receive one dose of vaccine have not been as protected against the Delta variant, and we've learned that from experience in India and the United Kingdom. So the variant does appear to be more contagious and may cause more serious disease as well, so it really behooves everybody to be vaccinated. Areas of our community that have lower vaccination rates could see some outbreaks in the weeks ahead related to the Delta variant, which is why, again, we have to get more people vaccinated. We have the supply and the capacity, as Becky mentioned. We have vaccine for anybody who would like to have it. We don't always have in-the-moment information on variants because the local laboratories don't do that. Most of the variants are captured through state monitoring programs or CDC monitoring programs. Occasionally, we can get that information, but we don't widely have it. So I can't comment on that. I can tell you that I think that's probably occurred. And as this Delta variant increases in frequency from 10% of the nation to higher, again, 91% of the United Kingdom, we can expect there will be deaths from those variants because we think that that variant is more contagious and potentially more deadly for those who get it. Again, get vaccinated because the vaccine is holding up pretty well after, of course, both doses. You need to get both doses to protect yourself.